If you or a family member spent time in a skilled nursing facility under Medicare Part A and you paid out of pocket for prescription drugs during that stay, there is a very good chance that some or all of those charges were illegal. Not questionable, not gray area, illegal under Medicare's own rules. And the government's auditors have now documented this in writing, with dollar amounts attached, and have told CMS directly to go back and recover the money. The number the OIG put on this problem is $465.1 million. That is how much Medicare Part D paid for prescription drugs during Part A skilled nursing facility stays between 2018 and 2020. Drugs that, under federal law, were already supposed to be covered under Part A and should never have been billed to Part D at all. And because Part D charges copays and coinsurance that Part A does not, a portion of that $465.1 million came directly out of the pockets of the patients and their families. The OIG confirmed this. CMS concurred with every recommendation in the report. And the problem, according to a CMS alert issued in May 2025, is still happening. Most seniors and most families have never heard this rule explained, which is exactly why the billing errors keep occurring, and exactly why the charges keep landing on people who had no way to know they were being billed for something that was already paid for. I am going to walk you through the 4 specific categories of Part D drug charges that are illegal during a Part A skilled nursing facility stay, why each one violates Medicare's own rules, and what you need to do to get a refund. Stay with me through all 4, because the form I am going to point you to at the end, which takes about 10 minutes to complete, is the step that most families skip, and it is the only step that actually gets the money back. Before we get into it, I want to hear from you. Were you or a family member in a skilled nursing facility and charged copays for medications during that stay? Tell me in the comments. I want to know how widespread this is in the community watching this. And before anything else, everything I share here is educational, not personalized legal advice. For help with a specific situation, contact your state health insurance assistance program, SHIP, which is free. With that said, let us get into it. My name is Walter Barron. I am a state bar licensed estate attorney, and for more than 15 years, I have worked with families on Medicare disputes, billing errors, and the paperwork nobody explains until the money is already gone. Let us get into it. Before the 4 charges, you need to understand one foundational rule, because everything else flows from it. When Medicare covers your stay in a skilled nursing facility under Part A, meaning you had a qualifying hospital stay of at least 3 days as an inpatient and were transferred to a skilled nursing facility for recovery, Medicare Part A's payment to that facility is a bundled, all-inclusive payment. It is called a prospective payment, and it is designed to cover everything the facility provides during your stay: room, board, nursing care, therapy, and prescription drugs used in the facility for your care and treatment. That bundled payment means that a Part D drug plan, your drug plan, the one that covers your prescriptions when you were at home, is legally excluded from paying for those same drugs during your Part A SNF stay. The law is explicit on this point. Part D excludes drugs for beneficiaries in Part A SNF stays if those drugs are for use in the facility. The SNF is already being paid for them. If Part D pays anyway, that is a duplicate payment. And if Part D charges you a copay for those drugs, that is an illegal charge, because Part D should never have been billed for them in the first place. This is the rule that $465.1 million worth of drug charges violated between 2018 and 2020 alone. And it is the rule that CMS, prompted by the OIG audit, is now telling skilled nursing facilities they must follow when submitting billing for drug claims. The first illegal charge is any prescription drug copay or coinsurance you paid during a Part A SNF stay for a medication used in the facility for your care. This is the most common version of the problem, and it is the one that shows up most clearly in the OIG audit. The sequence goes like this. You are in the skilled nursing facility, recovering from a surgery or an illness. The nursing staff administers medications to you: pain management, blood pressure medication, antibiotics, anticoagulants, whatever your treatment requires. The facility's pharmacy department generates a billing record for those drugs. That billing record gets submitted to your Part D plan rather than being included in the facility's Part A consolidated payment to Medicare. Your Part D plan processes the claim and generates a copay or coinsurance charge. That charge is mailed to you or directly applied to your account. You pay it because it looks like a normal prescription bill. But the facility had already received payment for those drugs from Medicare Part A. Your Part D plan should never have seen that claim, and you should never have paid that copay. If you paid any drug copays while inside a skilled nursing facility during a Part A stay, not for medications you were taking before the stay, not for medications you would take after discharge, but for drugs administered to you while you were physically in the facility, those payments warrant a direct review. Call 1-800-MEDICARE and ask them to pull the Part D claims filed on your behalf during the dates of your SNF stay. Ask whether any of those claims were for drugs administered during a covered Part A period. If yes, you have grounds to request a refund. The second illegal charge is the copay you paid for a drug that was dispensed specifically to prepare you for discharge from the facility. This one surprises people more than the first because it often feels like a different category. You are being discharged. The facility gives you a short supply of a medication, enough to last until you can fill a new prescription at your regular pharmacy or until your next doctor's appointment. That supply might be 3 days worth or 5 days worth, and a copay comes with it. Under Medicare's rules, a limited supply of drugs provided to you at the time of discharge from a skilled nursing facility is covered under Part A if those drugs are medically necessary to help you leave the facility and are needed until you can obtain a continuing supply. In other words, the facility's Part A payment covers a reasonable discharge supply of your medications. Part D should not be billing for them. The OIG's audit found this happening in both directions: drugs billed to Part D that were clearly administered inside the facility, and drugs billed to Part D that were dispensed as part of the discharge process. In both cases, the billing should have stayed under Part A. In both cases, if a copay was charged to you or your family, that charge may have been improper. The third illegal charge is the ongoing Part D premium deduction that continued throughout a long Part A stay. In cases where a beneficiary was in a facility long enough that the question of which program should be covering the drugs changed over time. This one requires a small amount of context. A Part A stay in a skilled nursing facility has a defined benefit period. Medicare Part A covers the first 20 days at no cost to you, then covers days 21 through 100 with a daily coinsurance. Beyond 100 days, Part A coverage ends entirely. Once Part A coverage ends, the rules about drug coverage change. At that point, Part D can legitimately cover the resident's prescriptions. The problem the OIG flagged is not in the long-term period. The problem is in the Part A period, the weeks when Part A was active and was already paying the facility for drugs, but Part D plan sponsors were simultaneously processing drug claims and charging the beneficiary copays for the same medications. For some patients in the OIG's sample, this was happening simultaneously: Part A covering the stay, Part D being billed for drugs during the same period, and the patient paying a copay to Part D that should never have existed. If you or a family member was in a skilled nursing facility for an extended stay, several weeks or longer, and you paid regular drug copays throughout the stay rather than just at discharge, it is worth reviewing whether those copays were charged during the active Part A period, when they were not legally permissible, or during the period after Part A coverage ended, when Part D billing was appropriate. The fourth illegal charge is the most overlooked of all four, and it is the one that most families discover only after the stay has ended and the bills have already been paid. It is the charge that appears on your Part D explanation of benefits for drugs that were administered during your SNF stay. drugs that neither you nor the facility ever questioned, that were billed automatically through the existing prescription drug system, and that generated a copay nobody thought to challenge because the bill looked exactly like every other Part D copay that had arrived for years before the stay. The OIG's audit found, for 89 of the 215 sample items reviewed, that medical records from the facilities confirmed the drugs were actually administered to the beneficiaries during their Part A SNF stays, not dispensed for home use, administered inside the building by nursing staff during a period when Part A was the applicable coverage, and Part D billed for them anyway, and patients paid copays for them. And CMS has not yet finished recovering the money. The OIG's recommendations from this audit were still listed as open and unimplemented as of 2026. The reason this fourth category matters separately is that it is invisible without a review. You cannot know by looking at a Part D copay bill whether the drug in question was administered during a Part A SNF stay. The bill does not say that. The plan does not volunteer the information. The facility rarely flags it. You would only know if you compared your Part D explanation of benefits to the dates of your SNF Part A stay, drug by drug, and asked whether the billing lined up correctly. That review takes time, but it is the only way to find this specific type of improper charge. Now here is what to do. The first step is to collect two specific documents and put them side by side. The first is your Medicare summary notice or your Part D explanation of benefits for any period that overlapped with a skilled nursing facility stay. The second is a record of the exact dates of your Part A SNF stay, the admission date and the discharge date. You can request both of these through mymedicare.gov if you have an online account, or by calling 1-800-MEDICARE and asking them to pull the records. If the stay involved a family member, and you had power of attorney or were listed as an authorized representative, you can request those records on their behalf. Once you have both documents, compare the dates. Look at every Part D drug claim that falls within the Part A SNF stay period, meaning any drug your plan was billed for on a date when the Part A stay was active. Each of those claims is a candidate for review. Write down the drug name, the date of the claim, and the copay or coinsurance amount you were charged. That list becomes the basis for your refund request. The second step is to contact your Part D plan directly and submit a formal grievance. The word grievance matters here because it is a legally defined process under Medicare regulations. You are not filing a coverage appeal, which is used when a plan refuses to cover a drug you need. You are filing a grievance about an improper charge that was already collected from you. Call the member services number on the back of your Part D plan card and tell them you want to file a grievance regarding Part D copays charged during a Medicare Part A skilled nursing facility stay. Cite the OIG audit by name. Medicare Part D paid millions for drugs for which payment was available under the Medicare Part A skilled nursing facility benefit. And cite the CMS guidance from May 2025 directing plan sponsors to identify and adjust improper Part D payments during Part A SNF stays. Ask them to review the claims from the dates of the stay and issue a refund for any copays collected during the covered Part A period. Ask for the name of the representative, the grievance case number, and confirmation that you will receive a written response. Plans are required to respond to standard grievances within 30 days. The third step, if the plan does not act or gives you an unsatisfactory response, is to escalate to Medicare directly. Call 1-800-MEDICARE and ask to file a formal complaint against your Part D plan for improper billing during a Part A SNF stay. You can also file online at medicare.gov. When you speak with a Medicare representative, tell them you are referencing OIG Report A-09-21-03008 and the May 2025 CMSMLN alert on SNF Part D billing. Those specific references signal to the representative that this is a documented, audited issue with a government record behind it, not a general complaint. That distinction changes how it is processed. The government's auditors found the problem, documented it in writing, quantified it at $465 million, and recommended that CMS go back and recover the money. CMS agreed with every recommendation. The billing error is a matter of official federal record. The only remaining question is whether the money that was incorrectly taken from patients and their families actually gets returned. That does not happen automatically. It happens when the right questions are asked in the right process. Now you know what those questions are and exactly where to ask them. If you know someone who spent time in a skilled nursing facility under Medicare Part A in the last several years and paid drug copays during that stay, please share this with them. The window for requesting a refund is not indefinite. Thank you for watching.